We want to talk about double circulation. Like we have this ज़माने रोकिया मैनू. Okay, lungs. हमारे पास ये lungs है. Then we have pulmonary vein, and this is left atrium. And lower we have left ventricle. So blood comes from here to this, and then it goes towards right atrium. नहीं. It is a movement of blood from the heart to the lungs. Okay, to the lungs and back to the heart again. Deoxygenated blood is pumped out of the right ventricle into the pulmonary trunk, then to the pulmonary arteries and into the lungs via pulmonary veins. Okay. ज़माने रोकिया मैनू रही फिर भी मिलदी मैं तैनू याद आवांगी. Here are the body parts. Okay. That's a pulmonary vein. This is dorsal aorta. Vena cava. And this is pulmonary artery. Okay, we're going to start. We're going to understand the concept now. So basically, this is the concept. The It's the superior vena cava. Deoxygenated blood is pumped out of the right ventricle into the pulmonary trunk, then to the pulmonary artery and into the lungs via pulmonary veins. Oxygenated blood is then drained into the left atrium. Okay, this side is the deoxygenated going. Okay. Sorry. Means right ventricle से होते हुए राइट वेंट्रिकल से डीऑक्सीजनेटेड ब्लड जा रहा है लंग्स की तरफ, फिर इधर से ऑक्सीजनेटेड होकर पल्मोनरी वेन्स उसको ला रही हैं लेफ्ट एट्रियम में, ड्रेन कर रही हैं. एंड देन फिर लेफ्ट वेंट्रिकल से वो जा रहा है ऑल बॉडी पार्ट्स, और फिर डीऑक्सीजनेटेड ब्लड फिर राइट एट्रियम में आ रहा है. Blood is pumped out of the right ventricle into the राइट वेंट्रिकल से ब्लड पम्प्ड आउट होता है और जाता है लंग्स में, क्योंकि उसमें डीऑक्सीजनेटेड है. ठीक है, फिर से पीछे बनाते हैं। ज़माने रोकिया हेयर इज द, ये है राइट, इस तरीके वी हैव राइट एट्रियम, left atrium, right ventricle, left ventricle. For okay, so right ventricle is draining deoxygenated blood out of itself into the pulmonary trunk, then to the pulmonary arteries, then to the lungs via pulmonary veins. Sorry, मतलब इधर arteries है, then via pulmonary veins oxygenated blood is then drained into the left atrium. ओके, लेफ्ट एट्रियम में ऑक्सीजनेटेड आया है, then the flow of oxygenated blood from the left ventricle to all parts of the body. Body parts from left ventricle to the all body parts. Then again from here, deoxygenated blood from the various body parts to the right atrium. ज़माने वेखिया. This is a systemic, and upper is the, what is this? Pulmonary. कि पल्मोनरी ऊपर है ना, ये हार्ट है हमारा बीच वाला, तो मैंने उल्टा बना दिया, नहीं ठीक ही बनाया. Now we have some disorders of circulatory system. Here also we can write, I guess. Hypertension is the most common disease affecting the heart and blood vessels. High blood pressure can harm heart, brain, kidneys, and eyes. A blood pressure of 120/80 mmHg is considered normal, but the increase in BP beyond 140 and 90. Upper is the systolic by diastolic. It's called the high blood pressure. Blood pressure is defined as the force with which the blood exerts on the walls of the artery. When the left ventricle contracts, pushing the blood into the aorta, the pressure produced is known as the systolic blood. कहाँ गया हमारी diagram? When the left ventricle push the blood into the aorta, here, the pressure produced is known as the systolic blood pressure, which is, it produces systolic BP, which is 120. And when the complete diastole occurs, the heart is resting. The pressure within the blood vessel is called the diastolic blood pressure. Okay, the blood pressure is expressed as BP. The difference between the systolic and is called the pulse pressure. Contracts, pushing the blood into the aorta. When the left ventricle contracts, pushing the blood into the aorta. ज़माने रोकिया मैनू मैं रही पैरवी. Then we have sclerosis, or the CAD, which is coronary artery disease. Okay. It is a deposition of lipids on the wall line, the lumen of the arteries, called the arteriomatous or the arteriosclerotic plaque. These plaques may complete block the arteries. Such plaques, if formed in the coronary artery, reduces the blood supply to the heart and may result in the heart attack. coronary artery मैंने बनाई है यहाँ पे, नहीं बनाई. कोलेस्ट्रॉल डिपॉजिट हो जाता है basically in this. Then we have angina, is also known as angina pectoris. Symptom is occurrence of acute chest pain when enough oxygen is not supplied. Enough oxygen is not reaching the heart muscle. It occurs in men and women of any age, but more among middle age and elder person. It occurs due to conditions that affect blood flow. Heart failure, cardiac arrest, and then the heart attack. Is a state of heart when it is not pumping blood effectively to meet the needs of the body. It is also known as congestive heart failure. The congestion of lungs is the main symptom. Cardiac arrest is a state when heart stops beating. Heart attack occurs when the heart muscle is suddenly damaged by an inadequate blood supply. Oh, there was enough space. But ठीक है, जो भी है. Okay, next we have this. So this is the here. This is the inferior vena cava, right atrium, and right ventricle is this. So deoxygenated blood is entering from here, from the body parts, and into the right atrium. No. What the heck, yaar? But from the body, it is entering into the right ventricle. Then blood is entering into the right atrium. Then it transfers to the right ventricle, and then the right ventricle gives it to the lungs for the filtration, and then the oxygenated blood enters into left atrium, from where it goes into left ventricle, and from the left ventricle it goes aorta here, okay, to the body parts. ਜ਼ਮਾਨੇ ਰੋਕਿਆ ਮੈਨੂੰ, ਮੈਂ ਰਹੀ ਫਿਰ ਵੀ ਮਿਲਦੀ. ठीक है यार, इतना ही हो सकता है, इससे ज़्यादा क्या ही हो सकता है. Superior vena cava, right atrium is consist of superior vena cava and the inferior vena cava. Okay, superior vena cava brings deoxygenated blood from the head and upper region of the body, right? And the inferior brings from the lower region of the body. तो superior vena cava ऊपर बनाई होगी फिर. हाँ, सुपीरियर वेना कैवा ऊपर है, जो सर से लाती है। इन्फीरियर नीचे से लाएगी, है ना। देन left, okay. The wall formed of two cusps separating the left atrium and the left ventricle is called the bicuspid. Here we have bicuspid between these two. Bicuspid valve, okay. और द मिट्रल, जिसको हम मिट्रल भी बोलेंगे, और मिट्रल, द वॉल फ्रॉम द थ्री cups separating the right auricle and right ventricle is known as the tricuspid. Here we have tricuspid. Chordae tendineae are attached to the flaps of bicuspid and tricuspid with the papillary muscles. Semilunar valves are present where arteries leave the heart. Where arteries leave the heart? Arteries leave the heart? Do they? Pulmonary trunk and aorta. Dorsal aorta. This is aorta, na, this side. ज़माने रोके हमें पैरवी मिलती. Heart is this and aorta is leaving from this. Wait. Arteries bring blood. Arteries take blood away from the heart toward the body tissues. Okay. So the right atrium receives two large veins, which are superior vena cava and inferior vena cava. The superior brings deoxygenated blood from the head and upper region, and the inferior brings deoxygenated blood from the lower region of the body. The left atrium receives oxygenated blood from the lungs via pulmonary veins. Left ventricle is thicker than the right ventricle because it has to push blood to all body parts at a much greater pressure. Fine. Now, right atrium is receiving this. So, semilunar valves are the present where arteries leave the heart, that is, pulmonary trunk and aorta. Arteries carry blood to the body parts. And the arteries is the only artery which carries deoxygenated. Pulmonary artery is the away from the heart towards the body tissue. Here, Semilunar valves are present here and this side. That's all right.